Welcome to our webinar today on Medicare insurance. I'm going to be dealing with you all the basics and all the secrets you need to know about Medicare insurance. Make sure you have the right plan in place. In the question and answer area, would you just raise your hand? I think there's a raise your hand area. Would you just raise your hand and let me know if you currently are on Medicare insurance? So I've got 3 people who are on. Cindy, Thomas, and Joe are all currently on Medicare. I'm going to assume that you're looking to learn a little bit more about it today, and you're interested in taking advantage of what's called the open enrollment period, which begins tomorrow. And for the rest of you who are not on Medicare, will you be eligible in the next 3 months? Raise your hand. Okay. Very good. Okay, great. So let me just start with a little bit of what's going to happen today. My name is Martin Coward, and I am a independent Medicare insurance representative. It means that I am licensed with a variety of carriers. I think about 8, all the major big carriers, that maybe even more. So it gives me the advantage, if you will, to be able to approach Medicare insurance from an unbiased position. My dedication is not to any particular carrier. It's basically, it is to you, my client, potentially my client, who make sure that you've got the right plan in place that's best for you. So I'm looking at hearing your story and hearing what you need so we can find the right plan for you. But first, we're going to start with me showing you a video today. It's called the ABCDs of Medicare. I'm waiting on a new video. It's a little bit dated. The content is accurate. It's some of the basic understanding of Medicare is all accurate. Some of the numbers are, because it was made back in 2017, are a little skewed. But don't be disarmed. I'm waiting. I'm hoping I'd have a new one today, but you'll get the basic information and it's all correct. The thing is, what you want to know is that AEP, which is the annual enrollment period, provides all people on Medicare insurance an opportunity to look at their plans and to determine if the plan they currently have is the best plan for them, or if there's a new plan out there that might be a better alternative. And that's what we're going to talk a little bit about today, specifically after we watch the video, is what would make one plan, what might be something that could happen that would make the plan that I'm on now not as good as the plan I have what's available going forward. So we'll look at all of that. But first, we want to just look at this video because I think it can give us enough. The idea of the video is to give you enough information to maybe ask me some questions. You'll need to take notes. Just think about if something comes up that you're not sure about that you think pertains to you, save it and then write it down. And we're going to cover the best part of this live webinar, I believe, is the Q&A period, because it gives you a chance to ask me things that are pertinent for you. And I will answer those questions to the group. If there's you'll have an opportunity at the end to access my calendar. And if you want to find out more about on a personal level about how I can help you find the right plan, we can schedule that for another time. But everything today will be pretty much generic, and I won't talk about anybody's personal medical history unless they bring it up here. This is not a private space. Understand we're in a group here. But I'd be happy to meet with you to talk about some of those things more in private later. So let's watch the video. Again, be ready to to write down some questions, and we will discuss anything you want to talk about after we watch this short. It's about 15 minutes long, and let's take a look and see what we got. And if this doesn't show, we all just raise your hands and say, I can't see anything, and we'll try to get it right. All right. see, share my screen.
Hello, and welcome again. Thanks for joining us today for a Medicare meeting. We're here to help you learn more about your Medicare coverage options and ready to walk you through the ABCDs of Medicare. These are the parts of Medicare that will help you put together the right coverage for your own personal health needs and budget. Your host today is a licensed independent broker and is well prepared to answer your questions or provide you with more information on your Medicare options. Let's get started by answering a few important questions. First of all, what is Medicare and who is eligible for it? Medicare is our country's health insurance program for older adults or those with certain disabilities. You are eligible for Original Medicare if you are a U.S. citizen or a permanent legal resident for at least 5 years and age 65 or older and eligible for Social Security, or younger than 65 and have certain disabilities, such as end-stage renal disease. When can you enroll in Original Medicare or other Medicare options? Medicare's enrollment periods include the initial enrollment period when you can sign up for Medicare during a 7-month period that begins 3 months before the month you turn 65. It also includes the month you turn 65 and ends 3 months after the month you turn 65. Next, there's an open annual enrollment period, which happens each year from October 15th to December 7th, when anyone with Medicare can join or switch plans. If you enroll during open annual enrollment, your coverage will begin on January 1st, as long as the plan gets your request by December 7th. Another option is the open enrollment period. Between January 1st and March 31st, Medicare Advantage members may make one switch to a like plan or return to Original Medicare, but may not add or remove Part D drug coverage during this time. And finally, there's the special election period for people whose special circumstances allow them to enroll in a plan outside of the other enrollment periods. You can enroll in a plan during the special election period if you retire or lose your employer coverage, move outside of the plan's service area, receive state assistance, have qualifying disabilities or chronic health conditions. So, what are the ABCDs of Medicare? Once you qualify for Medicare, you have options to consider. These are Medicare's ABCDs. Let's call them your Medicare building blocks. You can put the blocks together in a way that's right for your healthcare needs and your budget. Part A and Part B are the foundation building blocks. They are often called Original Medicare. Medicare Part A helps cover hospitalization expenses. Medicare Part B helps cover medical expenses, like doctor's visits and outpatient care. Part C is called Medicare Advantage. The Part C block always includes Part A and Part B benefits, but it may also include extra benefits that you wouldn't typically have with Original Medicare. For example, it may also include Medicare Part D prescription drug coverage right in the same plan. Part D, of course, is Medicare prescription drug coverage. This helps you cover the cost of your medications. And finally, there's a block without a letter. It's called Medicare Supplement Insurance. This policy can help fill coverage gaps and pay for things such as co-payments, co-insurance, and deductibles not covered by Original Medicare. Many people have this extra coverage, but it can be quite expensive. Here's something to keep in mind. If you don't sign up for Medicare Part B when you are first eligible, or if you drop it and get it again later, you may have to pay a late enrollment penalty for as long as you have Medicare. Your monthly premium for Part B may go up 10% for each full 12-month period that you could have had Part B, but didn't sign up for it. So, let's see how you can put these blocks together to build the coverage that's right for you. First, you can choose Part A and Part B, or Original Medicare, as it's often called. You'll have your choice of doctors, hospitals, and other providers that accept Medicare. But what about your costs? For Part A, you'll pay a deductible if hospitalized. That's currently $1,316 per benefit period. For Part B, you'll pay a monthly premium of $134 for most people, as well as a deductible of $183 per year. Once you meet your deductible, Medicare pays its share, typically 80%, and you pay the remainder, typically 20%. One thing to keep in mind is that there's no cap or limit on what you could be responsible for paying out of pocket each year when you choose only Original Medicare, or Part A and Part B. What about your medications? If you want prescription drug coverage, you'll need to join a separate Medicare Part D drug plan with a separate monthly plan premium. And if you want extra coverage to help pay some of your copays, coinsurance, and deductibles, you may want to buy Medicare supplement insurance from a private company. That's another separate policy with separate monthly premiums. Plus, it doesn't include your prescription drug coverage, which means you would need to add a Medicare Part D plan with a separate monthly premium. It all starts to add up, but you have another option. You could choose a Medicare Advantage or Part C plan, such as HMO or PPO. Remember, Medicare Part C includes Part A, hospital, and Part B, medical. It often includes Part D drugs, too. Plus, extra benefits or services not covered by Original Medicare, such as vision or dental services. In most plans, you'll use the plan's doctors, hospitals, and other providers, or you may pay more or all of the cost. You may pay a monthly premium for your Medicare Advantage coverage, in addition to your Part B monthly premium, which you continue to pay. Many plans have low monthly premiums. You'll have copayments or coinsurance for all your covered services, which vary by plan. There are other advantages of Medicare Advantage plans. They are offered only by private insurance companies that have contracts with Medicare to provide these services. There's a yearly limit on what you could pay out of pocket, so you're protected in the event that you have a significant health situation and expense. And you avoid the added cost of a Medicare supplement plan. Think of Medicare Advantage as all-in-one Medicare coverage. So you can see, there are different ways to get your Medicare coverage. Use your Medicare building blocks to get the coverage that fits your healthcare needs and budget. This is quite important, so let's review it again. You can choose Original Medicare, Part A and Part B, and stop there. Or you can add a Medicare Part D prescription drug plan for an additional monthly premium, and maybe even a Medicare supplement policy to cover gaps and expenses not covered by Original Medicare. Medicare supplement policies can cost $200 to $300 per month, or $2,400 to $3,600 a year upfront, meaning you pay this additional monthly premium regardless of whether you need the added coverage. Or you can choose an all-in-one Medicare Advantage plan, or Part C, that rolls together Medicare Part A and Part B, and usually Part D, drug coverage, plus additional benefits and services, which vary by plan, into a comprehensive all-in-one Medicare plan. The plan comes with a yearly limit on what you could pay out of pocket. Many Medicare Advantage plans have $0 or low monthly premiums, and you will not need a Medicare supplement when you select a Medicare Advantage plan. Not surprisingly, with all these advantages, Medicare Advantage is growing in popularity. Enrollment in Medicare Advantage has increased 33% from 2010 to 2017. It now accounts for 19 million people in the U.S. Almost one-third of all people with Medicare choose Medicare Advantage. Of those people enrolled in Medicare Advantage, 90% are satisfied with their plans, 94% are satisfied with the quality of care they receive, and 90% are satisfied with the benefits received in their Medicare Advantage plan. So what are the top reasons people choose Medicare Advantage plans? Coverage. Medicare Advantage plans typically offer more benefits than Original Medicare. Plus, they often include Part D coverage, so you have all the coverage you need in one plan. Cost. The costs of monthly premiums, deductibles, and copays may also be more affordable than other options. Remember, there's a limit on yearly out-of-pocket expenses, so your wallet is protected. Convenience. Medicare Advantage plans offer all-in-one convenience for your medical, hospital, and depending upon the plan you select, drug benefits in one plan. Care. Medicare Advantage plans collaborate closely with your doctors, nurses, and specialists to make sure you get the care you need when you need it. Let's make sure that you understand the basics of Medicare Part D prescription drug plans, too. This information pertains to both standalone Medicare Part D plans as well as Medicare Advantage prescription drug plans, often called MAPD plans. How much will you pay for Part D coverage? Your drug plan costs will vary depending on the plan you choose and the monthly premium and cost-sharing amounts required. Your prescriptions and whether they're on the plan's formulary, which pharmacy you use, whether it offers preferred or standard cost sharing, is out-of-network or mail order, whether you're enrolled in a program to help cover your Part D costs. This is important to know. You may have to pay a late enrollment penalty if you don't join a Medicare prescription drug plan when you're first eligible and you decide to join later. The cost of the late enrollment penalty depends on how long you went without what's called credible prescription drug coverage. This is prescription drug coverage, for example, from an employer or union that is at least as good as Medicare prescription drug coverage. Most Part D drug plans charge a monthly plan premium. You pay this in addition to your Part B premium. If you're in a Medicare Advantage plan with Part D drug coverage, your monthly Medicare Advantage premium already includes your Part D premium. Your Part D coverage has 4 stages each year, and your costs vary from stage to stage. Stage 1 is your yearly deductible. This is the amount you must pay before your plan begins to pay its share of your covered drugs. Some drug plans don't have a deductible. Be sure to check this. Stage 2 is the initial coverage stage. You pay only your copayment or coinsurance for your drugs. Stage 3 is known as the coverage gap. After the total amount of your drugs paid by both you and the plan reach $3,750, you enter the coverage gap or donut hole. You have to pay for your drugs until your total drug costs reach $5,000. The good news is that the Affordable Care Act shrinks the donut hole little by little each year, until it is eliminated entirely in 2020. Stage 4 is called catastrophic coverage. If your total drug costs are higher than $5,000 for the year, you enter the catastrophic coverage phase. In this stage, you pay a small copayment or coinsurance for your drugs for the rest of the calendar year. You should also know about drug formularies and tiers. A formulary is just another name for the list of brand names and generic drugs covered by a plan. Be sure to check the formulary for any plan that you're considering to be sure your medications are covered. And drug tiers are just a way of organizing a formulary's covered drugs into smaller groups, or tiers. Drugs in each tier have a different cost. For example, a drug in a lower tier will generally cost you less than a drug in a higher tier. Some covered drugs have additional requirements or limits on coverage. If you or your prescriber believe that a coverage rule should be waived, you can ask for an exception. The types of coverage rules a plan may have include prior authorizations. This means that you or your prescriber must contact the drug plan before you can fill certain prescriptions. Your prescriber may need to show that the drug is medically necessary for the plan to cover it. Quantity limits. These are limits on how much medication you can get at one time, and step therapy. In some cases, you must try one or more similar, lower-cost drugs before the plan will cover the prescribed drug. Finally, people with Medicare have rights and protections which are good to know about. You have the right to ask the plan to provide or pay for items or services you think should be covered, provided, or continued. This is called an organization determination. You have the right to request a review of certain decisions about healthcare payment, coverage of services, or prescription drug coverage. This is called an appeal. You have the right to file a complaint, including complaints about the quality of a plan's care. This is called a grievance. Medicare Part D and Medicare Advantage plans are required to have appeals and grievance procedures. They are designed to protect you. Your rights and protections are explained to you in the evidence of coverage document for your plan. The member service department at your plan also can help explain them. Now that you understand your Medicare options and know how Medicare Advantage plans work, How do you know if you're enrolling in the right plan for your situation? Talk to your doctor. Your doctor will know which plans are easy to work with and do the right things for their members. Talk to an expert. Licensed agents like ours work in your local community and are specially trained to help people like you understand your Medicare choices. It's their job to help you find the right coverage. Finally, look at Medicare star ratings. Medicare evaluates plans based on a 5-star rating system on things from member satisfaction to how well they keep their members healthy. The more stars a plan has, the better it has scored in those categories. Look for a plan with higher star ratings. Before we wrap up and turn the program back over to your host, let's review what we've covered. So far, we've discussed the ABCDs of Medicare. Remember our Medicare building blocks and the various ways that you can put these blocks together to build the coverage that's right for you. Medicare Advantage and why this relatively new option is gaining popularity. Medicare Prescription Drug Plan Basics, and Medicare Rights and Protections. We also talked about when you can enroll in Original Medicare or other Medicare options. You can do this during the initial enrollment period when you turn 65, or during the open enrollment period each year from October 15th through December 7th. You can also enroll or make changes during a special election period if you qualify. Thank you again for attending our Medicare meeting today.
Okay, welcome back. I hope you enjoyed the movie and you have some popcorn. I've made it where everybody can actually talk if you like. You can either ask me questions in the Q&A if you have some, and I'll respond to the questions. You can also just raise your hand and I can call on you and you can tell me by a voice. Let me ask you a question. Do we have anybody who is a veteran? If you are, raise your hand if you are a veteran. Okay, no one's raising their hand. Most of the Medicare Advantage plans have come out with some incredible programs for veterans that I want people to be aware of. That really opens up opportunities for veterans to go well beyond the VA hospitals and the VA network. And that's great because sometimes they may have to wait in line or they may have to get into hospitals and stuff. And to be able to go to carriers and to hospitals and doctors in your local area that you want to go see that are in part of the Medicare program is a great addition to an advantage to Medicare, to veterans. And particularly since there's zero cost premiums on those programs, they don't call anything, and they're very good programs. So I wanted to address that. Any other questions? I don't see any Q&A here. Let's put it in. Please pop your question in. I don't believe you don't have questions. I mean, that video is good, but it's not that good. While you're trying to think of a question, let me tell you a little bit about AEP and why it might be important for you to arrange to have a review of if you're on Medicare and it's AEP is coming up. You definitely want to schedule a review of your current plan to see if it's still the plan that's right for you for 2021. Because I'm going to tell you something. All the carriers compete. The nice thing about Medicare is an incredible program, and having it in the hands of private insurers is to your advantage because they compete with each other to provide you the best benefit. They compete for star ratings, they compete for extra benefits, they compete on cost, and the plans for 2021 are extremely generous, much more generous than I've ever seen them, particularly in some of the extras such as dental and hearing and vision. These extra plans that in the past were just kind of like little extra thoughts that they did to try to get you to come on board, but they put some real teeth in these plans. Here's a question for me here. Is there any way to not have to pay for Part B? No, that's not That is Medicare and Social Security. That's not, there is no way not to have to pay for Medicare Part B. But I will tell you this. Some of the plans have a return of that premium. So if you paying $144, there are plans available that actually will reimburse you a portion of that, like $45. So there's a way to reduce it through some of the Medicare Advantage plans that have programs that will actually reduce the cost of that. We'll give you a credit for that, some of that money. Did that answer your question? There's a Q&A section there. Please either raise your hand or type your question into that. So Cindy, okay, let me go over here. Cindy Mansfield's got a question. If you could unmute your phone and just ask me your question. Cindy?
I have Medicare and Medicaid. Is there a program for that?
Absolutely. It's called a dual program, and it's a great program where they combine Medicare and Medicaid together. It's called a DSNP. And it would be a great thing for you to get into one of those programs. Yes, they absolutely do. And I highly recommend that you take advantage of that, because Medicaid will basically pay for almost all of your costs in your Medicare program. Are you Medicare eligible yet?
Yes.
Okay. Well, I would suggest that I'm going to put up on the board in a minute. I would suggest you go to my website and let's set up a time for you to meet with me, and we'll do an interview. We'll review it, and we'll try to find the best carrier out there that's got it's called a DSNP. It's called a dual special needs program. Dual meaning it covers both Medicare and Medicaid, and we can find you the specific carrier and the plan in your area that would best accommodate you. Where do you live? What area of the country do you live in?
New York.
Oh, good. I live in New Jersey. Yeah. I just put somebody in New York in one of those plans. So yes, absolutely. And I would highly recommend that you get in touch with me, and I'll give you that information before we leave, and let's set up a Zoom call one-on-one. So, because it's personal, and let's see what we can find for you. Does that seem like a good idea?
Yes.
Good. Yeah. I'd be happy to help you out. My pleasure.
Thank you.
Yeah. Yes, if I qualify for Medicare, what do you suggest? Like I just answered that question, David, that if you qualify for Medicaid, it's called a DSNP. It's a dual coverage plan where you have Medicaid and Medicare working together. Basically, you're under a Medicare coverage plan, like a Medicare Advantage plan, and Medicaid supplements it and pays for most of your cost. And it's a fabulous program. It's a great program. And just like I said to the woman I just spoke with, we'll schedule an appointment with me. It's a 20-minute interview that there's no charge, there's no risk. And I'll be happy to look at you and see what we can find. Where area, David, do you live in? What area of the country do you live in? Okay. Yep. I'm Florida's fine. We'll find you something in Florida. Absolutely. Absolutely. I'm happy to do that. Any other questions?
I have a question. This is Joe. So when we schedule an appointment with you, what would you like us to have ready to bring so you can look at everything?
That is if you're already on Medicare, then I just need to know the name of your carrier plan is. If you're new to Medicare, we need your Medicare number. We need the date you start your Medicare, your Part B eligible. If you could have a list of all your prescription drugs and a list of all your doctors and their locations, because what we want to do is we're going to create a medical profile on you. That's the driver of the whole decision-making process, is what your current medical profile looks like, meaning who are your doctors and what prescription drugs are you on. We start with that, and then we look in your area for all the plans that cover those particular doctors and those drugs. And we want to find a plan that's going to cover the most of those at the lowest cost. That's how we start. And then we look at among those plans, which one have the extra benefits that would be available for you. So it's your drugs, it's your prescription drugs, your Medicare number, and the date you started. Let's see, somebody says they're planning on moving all around the country. That kind of coverage is not location based. Well, are you going to, the answer, you're correct. There are, you need to have a home base, and but you do have some wiggle room there. How often the question would be, how often do you plan to move? Where is your home? Everybody has to have a home base somewhere in the United States. So even if you've got an RV and you're traveling around the country, that's okay, but you need some type of base. And then as you move, if that base moves, then you'd have to move to that coverage to that new location. There are carriers, a lot of the big carriers do have national networks, so that you would be able to have like coverage up to a year, for example. If you were traveling into a new area, you'd have a while that you could rely on the national network for coverage. But you'd have to eventually, if you live in a certain place for a certain period of time, you got to eventually move to that location. But again, Eileen, if you want to set up a time with me, we can look at what your actual plans are, and I can try to find you a carrier that's most accommodating to someone who's going to be traveling the country and moving around as much as you're planning to do. You're welcome. It's really one of the reasons that Medicare makes Medicare so complicated is that it covers so many different people and so many different circumstances that it sounds complex, which is why it's always good, which is why I enjoy being an independent, because I can sort of help navigate you through all that maze of information that you really don't need to know. You just need to know I'm a person that moves a lot and I want to have Medicare coverage. Where's the best plan for me? Then I can kind of help you, steer you in that direction. I'm going to share my screen. Oh, some new questions. Okay, that we all answered. We answered that one. We answered that one. Okay. Let's see here. Let's see. Anybody? Cindy, your hand's still up. Is that from last time? Cindy, your hand was still. I didn't put it down. Happy to help you out with that. So I'm going to put my email address up on the screen for you, and so you can see it. That's the easiest way to get in touch with me. You can just send me an email at martin@martincowardinsurance.com. And you can go right to my website, and you can just go to my calendar at martincowardinsurance.com, and they click on that, and you can go right to my calendar and book an appointment yourself. I have all that laid up for you, so that it's really I make myself easy. I want to help you because I make myself as easy to reach as possible. Like I said, the point of this webinar is for you to get to know that there's somebody out here that cares enough about you to show you what's going on with the carriers and how to get the best coverage. It's great. It's a great program. I mean, I'm amazed at how well it works, and I'm a little concerned about some of the political stuff going on right now that might have some negative impacts on it. But let's hope we get people in power that protect our health insurance. Let's just ask for that. Because we need health coverage, and particularly as we become seniors, and we earned it. It's not an entitlement. We all paid for Medicare insurance. We paid our whole lives for it. Came out of our paychecks. So everybody that's got Medicare insurance, most people pay for it, and you deserve it, and you deserve it to be good, and it is good. Any more questions? Okay, well, send me an email at martin@martincowardinsurance.com, or you can just go to www.martincowardinsurance.com, and you'll see a button to go right to my calendar and go to open my calendar and schedule a 20-minute interview with me. And when you do that, there's also a list of things you need to do to prepare for that, interview, that conversation. Anything else y'all want to say? Y'all are a quiet bunch. Are you feel as you have all did you is it that you just don't know the right questions to ask, or you know what, you're not sure? There's no stupid question, by the way. I'm happy to answer anything you got. So, while you're here, take advantage of it. I've also, another thing I'll just let you know about is okay, Cindy, what was your question?
You have to stay in your zip code area for plans?
Not necessarily. We find plans by zip code. It's typically, somebody asked me how I get paid. I'll be glad to answer your question in just a second. That's a good question, and I'll be happy to answer. But no, you do not have to stay in your, but you got to stay in your region. But not to change plans. But if you're in New Jersey, for example, and you're in northern New Jersey and you move to southern New Jersey, you're good for a while. Then you might want to move. You want to move your plan because you want to get local doctors and hospitals in southern New Jersey. It's really more of a convenience to you because you want to go to doctors that are located near you. I mean, I live in New Jersey, and I have a New Jersey plan, but I go to a doctor in Manhattan that's in that New Jersey plan. So you don't. The answer is yes and no. It depends on. Not really. You know, if you're, it all depends on how far you move.
Thank you.
And how I get paid. You want to know how I get paid? I get paid ultimately by Medicare. What happens is I don't charge anything to you. You don't pay anything. But when you sign up for a plan and you sign up with me, with my help, if I submit the application for you to the carrier, let's just say it's Aetna, for example, then Aetna will process your application and they will enroll you into the Aetna plan that you choose. And then Aetna will pay me a commission for sending them the client, the beneficiary, sending you to them. Aetna on all the money that Aetna spends or United Healthcare spends, it all comes from Medicare. So ultimately, Medicare pays me to help you find the right plan, and the cost of the plan is the same whether you use me, you use an independent or not. So I'm a free service to you, and I would highly recommend you take advantage of it because why not? I mean, I want to make sure you get the right plan. It's not going to cost you any money. So. But that's how I get paid. I get paid by the carrier, who's ultimately paid by Medicare insurance.
Oh, geez.
Did that answer your question, Joe?
Yes, it did. Thank you.
Good. Good. It's a good question. How do I get paid? Another thing I'll just throw out before we close is if you want to, I've created a special website, a special Facebook group called Savvy Seniors Enjoying Medicare. If you want to join our Facebook group, you probably saw some notices of it in some of the emails you received from me and you prepared for this. Please join us, and it's an opportunity to join other people who may be having some victories and some challenges with Medicare, and they can share them. We can share them with each other in that space. So. Take advantage of that as well. Anything else? There will be a replay available in case you want to go back and look at this. That's available to you as well. And unless I see some more hands raised or some more questions, we'll sign out and let you get back to your day. Oh, Eileen, the name of the Facebook group is Savvy Seniors Enjoying Medicare. Savvy, S-A-V-V-Y, Seniors Enjoying Medicare. That's the name of the Facebook group. And I do a daily meditation on Facebook Live, and I post that meditation. it runs on that group as well if you'd like to do meditation. So totally different conversation than this, but it is something I do. I've been leading a daily meditation and contemplative prayer group since COVID-19 is a safe sanctuary for people to love and support each other through the pandemic. In case you want to be a part of that. Okay. Well, I want to thank you so much for taking the time out today to join me here and learn a little bit about Medicare insurance. Again, you got my website, you got my email address. I'd love to hear from you. I'd love to spend some time with you trying to help you find the right plan and be of some help to you. Okay. Thank you again, and I hope to hear from you.